Good afternoon, and I am Eric de Rodenbeck. I'm the CEO of the International Hospital Federation, and we are based in Geneva, Switzerland. So Switzerland is very well known for the chocolates, but you know it's the place also of the watch industry. So in Switzerland, it's very important to start on time. So I will be starting on time, and it's really a great pleasure and an honor for me to be facilitating this closing session with all of you, and I guess as we'll start to have some remarks, more people will be coming in. So having the privilege to be facilitating, it means I have these instruments called microphones that allows me to take the floor and share some remarks with you. So I'm going to hijack this phone and make some remarks. So first, and because, you know, after we'll have a formal closing, but before that, as the CEO of this organization, having worked on the program, on organizing all that, I really want to say a few thank you for a few of the partners of this program. First and foremost, of course, I want to thank the Ministry of Health from the Sultanate of Oman. I will not say all the names because otherwise I will have whole the session to thank individually. And as in management, we know the importance of how much the teamwork under the leadership of His Excellency the Minister is important. Please let me thank the whole Minister of Health for the great work, great job, for your kindness, for hosting us for this Congress. This might be a little biased because I'm involved in it, but I believe that we had a very well-organized conference and a great program offering a lot of learning opportunities. And I do hope that you were able to attend sessions that were of interest for you in regard to your topics of interest. But, you know, to maximize also your networking experience, we had a partnership with a startup company, so that shows that we are looking forward for innovation. That was also a support for this networking, the CERCA Hub. So I do hope that you made a good use of it, and don't forget, this is going beyond the Congress, because like in any Congresses, it's what you take away from the Congress, but it's also what you are carrying on after the Congress that is so important. But you know, organizing a Congress is a lot of logistics, and I want to take the opportunity also having the mic to thank those who have allowed and permitted this logistics. First, the team of the OECE, that's the Congress. I don't know if there is anyone from the OECE in the room, but I really want to thank them for how they always have been responsive and supportive to all our requests. Of course, also, you know, there is in any organization what we call a PCO, a professional Congress organizer. Here it was MCI, and I don't know if Ayad is here. Please stand. I really want also to recognize for their work. I know that I've been sometimes a pain to them. That's our role, to be a pain to you, but I really want to say that we really appreciate your responsiveness and responding to all our requests, even very late in the night after a gala dinner, and sorting everything out. So thank you so much. It's very important. I would like also, and that's my own team, but I really want to thank the IHF Secretariat, Patricia, who is standing there. She might little blur, but she is the master. So please, all compliments to her. If anything didn't work as you expected, it's for me. I also want to thank the rest of the team that was behind, that you may have seen. Miles, Sylvia, where is Sylvia? Behind. And Shane, who has been backing up the work. Among the people, you know, that is supporting, there is one person from Oman that I really want to thank. You know, because, you know, you have a lot of logistic things, and you have a person that really helped us to sort out the problems. It's Dr. Arit. Please, Dr. Harit, come here. I want to give you a hug. So, and I want you to support me in nominating Dr. Harit a new title. We have, the problem. He's Dr. Solution.
Thank you. Thank you.
So each conference is unique, and we all try to take back home some messages. So I would like you to just think a few seconds. Close your eyes and think, what is the key message I really want to take back home from this conference? I'm sure all of you have one. I would like to share the one I will take back home. I have to say that the presentation from Dr. Seita from UNRWA has really opened me something that I didn't realize when he said, we were created for 3 years and we have been working for 70 years. We have seen in the last presentation this morning that was made by our colleague from Iran, the importance of the refugees, the number. So we have these crises that are ongoing. What we know is that we have no clue how long a crisis will last. We know when it starts, we will never know when it stops. And I think in this region, the situation of the Palestinian refugees also is very much demonstrating how much health remains a critical need for all in time of peace and crisis, which was the topic of our conference. So really for me that was an important message. And also it means that what we all do in the health sector is so critical for the community we are serving, whether it's a small, a large community or the international community. And we should be proud of the role we are playing, while we should always stay modest and dedicated. Thank you very much. And as we are talking about reflection, let's have a look backwards on the time we have spent together with a short video. I guess that with this you also have memories you will take back home, and you cannot cheat with pictures. You have seen everybody was so committed, so invested in the learning and in sharing. So a congress is also about learning, sharing, and also recognizing. And so we'll move now with the Best Poster Awards. It's very important, we have seen in the video the posters. It's very also important to recognize the work, the experience that are shared through the posters. That's the reason why we have the awards. And we went through a very tough selection process. So same thing, I can take all the blame you want, but we really did a really tough selection process. So we had an international panel that was led by Professor Omar Al-Rawas, also the chair of the scientific committee, and now he's the Secretary General of the Arab Board of Health Specialization. We had Professor Helmut Kern, who is the CEO of the Hospital of the Brother of St. John of God in Vienna. And we had Ana Riera, who is membership director of the Catalonia Hospital Association, La Unió. So please come on the stage. And Omar, I think you have to take it from me to present the result of the judging.
You read the names.
Yeah, I will read the names.
Assalamu alaikum. Good afternoon. Thank you, Eric. It is actually a great honor and it's a pleasure for me, and I thank the IHF for giving me this opportunity and honor, first to chair the scientific committee and also to be part of the judging panel for the excellent posters. Because of the selection process, we had all excellent posters because the exclusion criteria from the beginning. So it was a tough task for the panel, and we have the panel as mentioned by Eric. And we are to select one for gold, and the gold winner will be getting a complimentary registration for the next conference in Barcelona. and then we will have like also the silver and the bronze. But because of they were very good ones, we also added 3 for merit certificates. So we will have 6 awardee, the gold, the silver, the bronze, and 3 merits. So I'll ask congratulations for those 6. And in fact, having to read all of them, I have learned so much. Because the topics are so diverse, and the experience from international, different countries and different setups, and it shows that how important gathering like this. For those who did not have the chance, I think many of these are in the process of progress, and I encourage everybody to continue the good work they started, and I hope we'll see some of this in the next conference. So Eric, if you would like to start calling the names.
Yeah, thank you very much, and I will be doing the reading. Just one additional thing: the posters, you may have missed them. They all will be on our website, so you please go back and have a look to them, because, as it was said, they are really worthwhile. So the first merit award that we want to call on the stage is for a project called Healthcare in Conflict Setting, Leaving No One Behind. Can I call Maha Al-Hakoum from the World Innovation Summit for Health from Doha, Qatar? So in the interest of time, while you are taking the pictures, I'm going to call the next one, but take your time for the pictures. The second project is robotic-assisted repair of complex ventral hernia. Does it paid off? Florian Trömer from Hospital of Brother of St. John of God, Vienna. Please, I'm scared. And while you are taking the pictures, the last merit award, and it's a long title, use of short message services. You use short messages with a long title. Reminders to improve the attendance rate of diabetes-related multidisciplinary services in general outpatient clinic. Let me call on stage Dr. Man Chi Dao from Hong Kong Hospital Authority. So, which I didn't mention, we'll also reach out to all of you, because you did not only win the recognition, but we'll reach out for you so that we can publish your work also in IHF publications. I would like now to call the bronze winner. The title of their poster was Patient Experience in an Acute Medical Unit for Complex Chronic Patients. May I call Dr. Raymond Camp-Salat from Hospital Plateau. The silver winner, and a system to enhance safety of surgical procedures, electronic surgeon credentializing management module. May I call on stage Dr. Sandeha Mujumdar from National University Hospital. And as we always wait for the gold award winner with the opportunity to come to Barcelona, inventory management in the National Heart Center. Please, Jamila Al-Saidi from Royal Hospital. And again, to avoid conflict of interest, the nationals never gave their advice on projects from their countries. And we really want to encourage, thank you also for the jury, for your contribution and for your support. Thank you so much. So we really want to encourage the posters, and as you may have seen, the call for poster is open, and you are most welcome to start to enter your posters or free paper suggestions for Barcelona. It's available now. So the other thing we really want to share with you is an important initiative that we have launched this year, because, you know, the future is always the younger generation. You know, I'm closer to the exit door than to the entrance door, so it's nice I may have experience, but I know that I'm not the future. The future we need to invest is the young executive leaders. So we have a program this year that we have prepared, and it was a very interesting program because we asked our members to designate 2 leaders. We had a gender balance group, and that's very important because I cannot imagine a future without a gender balance. And we came with 19 young leaders from 10 countries. And they work together because they are young leaders. So we didn't give them, you know, an assignment. We said, get together, think of as young leader, what do you think as your challenge, the most important challenge? And they came out, they worked together, and they are going to present us what they came out with, perhaps share a little of their experience. To be quite honest, they had full responsibility. We didn't oversee. We give them the capacity. So let me call on the floor the 3 executives that will make the presentations. Sarah Kazim. David Ross and Daniel Wong. So I'm not anymore the boss. You are the bosses, and you take it from there, and you'll call me when you are finished. I think it's 2 hours and 30 minutes.
At least 2 hours, yeah.
Please.
Yeah, thank you, Eric.
Organize yourself.
So, as Eric said, he has no idea what we're about to present, and so it'll be a surprise for everyone. But on behalf of our entire group, thank you so much to the IHF for this opportunity, but especially a big thank you to everyone here in Oman. We've had an incredibly welcoming experience. It's just been a wonderful experience, so thank you all. 6 months ago, we started something special as a group. And, I mean, Eric introduced sort of who we are and the countries we come from, but, 6 months ago, all 19 of us had never met. 4 days ago, we'd yet to meet in person. Yet we've been working on something very special. The IHF tasked us to do what we thought was best, right? There was really no guidelines in terms of what we could work on. And of the 19 leaders here in Oman, I just need to find the clicker. This is the group here with you today. And so the topic we chose was the impact of innovation and technology in healthcare, a very narrowly focused topic for a group of 19 people to work on. And so to narrow our work a bit, we developed 3 subtopics. The dynamic of change, so the changes that occur in an organization as you're innovating and implementing new technologies. The impact on care delivery to improve outcomes and efficiency. And the human factors. So what are the human factors that are part of either the success or failure of an innovation or technology implementation? And we heard some incredible examples this morning about some of these innovations, and many of which we talked about as a group. I'll pass it over to you, Daniel.
Thank you, Dave. Innovation technology, I think all of you must agree that it will be the future for healthcare setting. So the acceleration of these forces have reached a very high level of importance that, in fact, it affects the leaders to plan in future for both the healthcare delivery and also the workforce could deliver the care. As young leaders, I think we have the responsibility to study, to learn, and also to understand more the overall dynamic of change of this hot topic. It's really a challenge for us to find the best approach to study or summarize this broad topic. So finally, we have decided to use PESTLE to analyze this topic from different countries and to come up with the common themes and translated that to the advantages and disadvantages of each domain. I would like to say PESTLE is a very good one. There's 6 domains. The first one is political. Second is the economical and social, technological, legal, and economically. So we have come up in 3 points in the summary. The first one is, all of you may already know that there's an imbalance of public and also private sectors. It is a common problem worldwide. Continued merging of the 2 parties can really help to exponentially benefit to patients. Secondly is the evolution of training new leaders, which is competence on this topic. And also finally, it's important to challenge the traditional hierarchies so that it can be a shortcut or a bridge for the frontline staff to reach the high up level people like the chief executive, hospital executive, to help to deliver this process. So I would like to transfer back to Dave for the how to deliver the process of innovation technology.
Awesome. Thanks, Daniel. So I was part of the group that looked at, from a care delivery perspective, what are those opportunities for efficiency and improved patient outcome when you're talking about technology. And our group really started talking about maturity. And there was some discussions about maturity this morning. What is the level of maturity of your organization? That can differ significantly between organizations. And I think it's very important to define what is that problem you're trying to solve? What is that opportunity you're trying to harness? Because my next step forward for my organization will differ from Daniel's, will differ from Sarah's. And I think it's very important for us to make sure we're very clear on that before we move forward. Transformation is coming, it was said this morning, but that transformation for each organization will be unique. And if you're clear on your problem, you can move into what can technology do to help you? Can it help you? And I think as we're looking at what technology can do to help in your organization, whatever that technology is, it's broadly applicable. It's important to ask the question, should technology be helping? I think as a group we discussed that sometimes technology shouldn't actually be the answer. Human processes are still going to have a very important place in healthcare and sometimes shouldn't be replaced or maybe even augmented by technology. We need to be challenging ourselves in both directions. And there's so many examples of innovative technologies that we've heard about this morning throughout the conference, really, but using technology simply because we can is a pretty dangerous and potentially very expensive mindset. We need to be careful about when we're leveraging that. The jet fighter example this morning was a really great analogy for that. So at the same time, the technology options that are going to be available to us in healthcare are going to expand exponentially year over year. Across our careers as young leaders, we need the framework. We need frameworks going forward to evaluate, to make those decisions. And we don't have all those frameworks today to make those decisions because there's technologies that don't exist yet. They will in the future. But it's an important thing to be thinking about. How do we evaluate that decision? The next step we talked through was from a technology plan. If you're planning on implementing a technology plan, what is that measurement opportunity that you have? What can you do to produce data to help define that potential benefit and that lived benefit of a technology implementation? What is it going to do? How can you validate it? And we, as a group, really see data as a gateway to sustainability. I mean, that's sort of obvious, but some of that data collection early on is manual. If you don't have the technology, you need to do the legwork to do that. And but that data will help bolster your case for expanding that technology. Starting small may be part of your next step, right? Because data is going to be expensive to gather before you have that technology. But we need to be committed to it. And so from a funding perspective, as you start to gather data, you can start thinking about what are the funding models I'm operating in. And many of us across our groups still have experiences with funding models that don't fit. They either drive siloed thinking, they don't look across the cycle of care, or they don't properly support that innovation and technology that we need. It's a hard place to be in. And a good example of this that we discuss is that there's many funding barriers shared across the world for the implementation of telemedicine. Not necessarily a very complex, innovative technology, but many funding models don't equitably recognize some of those visits yet. And that alone is going to create a barrier to moving that forward. Poorly defined funding models will hamper your ability to innovate, and even if it's the right thing to do. So the measurement becomes so important to validate that success, to validate the efficacy of either a technology or an innovation. And we see sort of appropriate reimbursement as a key a key feeder of that cycle of innovation. But it's data that will enable that. So we really feel that from a cycle perspective and a process perspective, these are some of the questions we should be asking ourselves. Pass it over to you, sir. I can just flip it. Okay. Oh, no.
So our group was tasked by looking at the human factor in innovation, and we look at human factors as important factors that determine the success of an innovation. Our group came up with 4 position statements to try to describe the relationship between human factors and innovation and technology. Our first position statement looks at innovation as an opportunity to provide an efficient and better quality care. It is a key to transform the healthcare system to become more patient-centered and to deliver the 3 pillars of health: better quality of care, where we improve patients' experience, better health by developing a healthy population, and better value, where we reduce per capita cost. Our second position statement looked at the challenges and barriers to what that can affect an innovation process, and how we can, our third position statement, how we can overcome these challenges. So what are the challenges? Budget, everybody knows it's an important challenge in developing any healthcare system. However, it's not the only challenge facing the healthcare system. There are others. We have poorly developed or missing change management skills. Cultures that depends on hierarchy cultures, where they depend on experience rather than being open to ideas from individuals at the operation level. A third factor or third challenge is to lead a project in an agile mode is rare nowadays, and it is a major impeding factors toward successful development of innovation in the face of rapidly developing world. So here comes our third statement, which enforces the idea of developing skills, competencies, and abilities to be able to overcome these challenges. One of them is develop a proper management styles. We always talk about top-down management and bottom-up. Some people will say top-down is good, where you have a clear vision, you know where you're going. Others will see bottom-up approach is a good way to go. It's not one size fits all, it's a combination of both. We need to have a clear vision from leaders, from the top, but at the same time we need to enable individuals at the operation level to be actively involved in planning and implementing innovation. Other things are our culture, our organizations need to be risk-taking. We need to be able to experiment, be open to change. This is an important skill to develop within organizations. And a third competency or ability is we need to have, our organization need to be able to collaborate with other entities and stakeholders to complement our system. We shouldn't be seeing them as threats or competitors to our system. Our fourth and last statement looks at our role as healthcare providers, how we can make a successful innovation. What can we do? Well, number one, we need to be self-aware about change management skills. We need to have ongoing plans to develop competencies to be able to innovate. Having a budget allocated for planning alone is not enough. We need a budget that's available to ensure continuous training to maintain these competencies and ensure sustainability of systems. And a third thing is we can develop accreditation process, develop standards of competencies that can make whole organizations more able to develop change in a more systematic way. With that, we would like to conclude with 3 take-home messages. So we as healthcare providers and leaders, we are responsible to deliver a patient-centered care. This is what we have been talking all over the conference about. How we can do that? We can do that by bringing innovation as a way to bringing change. We need to have standards to adopt standards to bring up innovation. So whenever we think of innovation, we need to ask ourselves 3 questions. Do we really need that innovation? How it will affect us? How we can implement it? And when is the best time to work on it? And a third take-home message, we need to have mentorship programs. Again, to ensure sustainability. We shouldn't be stopping at one point. We plan, we implement, we are done. We have to ensure the future generations are mentored through the process to ensure sustainability. That concludes our presentation today. At the end, as a Young Executive Leader group, we would like to thank the IHF to give us this opportunity. Our community, our communication and collaboration throughout the last 6 months and with different young leaders from multiple disciplines, cultures, nationalities, enable us to look with a better view on our healthcare organizations, identify what other health systems looks like, and look through the eye of multiple disciplines, how can we make the healthcare system more effective and more efficient in delivering care. So thank you very much. That will conclude.
Thank you very much. Thank you so much. Thank you. And I would like to add 3 other takeaway messages. The first one, give responsibilities and you'll get results. Thank you. The second one, teamwork produce a lot of results. What can be more complicated than putting together people who are all around the world and don't know each other, coming from different systems, and they can get together and achieve something. Last but not least, globalization is here, because this was possible because beyond the fact that you have so many differences in your systems, your background, your responsibilities, we have common ground and we have to find solutions for this common ground. So a big round of applause for these 3 that did the communication for the group, and a big round. Can the member of the group stand up if they are around so that you can recognize them? And thank you so much. Thank you. Thank you. Thank you. So, and it's a nice wrap-up also for the session we had on innovation, this presentation. Any good things, must come somehow to an end, and now it's really the time for us where we can take off the handkerchief, because we have to give the handover, leave Oman, and move towards the future, which is going to be Barcelona. So it's time for us to say a good farewell to our host, and I would want to invite on stage Qasim Al-Salmi, my friend, who is the chair of the organizing committee, but I will also, as this will be an opportunity to do an handover, ask Roser Fernandez, the CEO of La Unió, and Enric Mangas, the president of La Unió, to join us on the stage. Qasim, the floor is yours, and yeah, please, everybody, come on the stage.
Assalamu alaikum. Well done, Royal Hospital. Okay. Distinguished guests, colleagues, delegates, ladies and gentlemen, good afternoon. We have reached the end of the 43rd World Hospital Congress. 4 exciting days that were filled with many activities, courses, plenary and concurrent sessions. You all came to Muscat from many regions of the world to learn and teach others, to inspire and get inspired. to share your experience, knowledge, and wisdom. I hope that each one of you is leaving Oman with many great memories, and you have managed to experience this wonderful country with beautiful geography and kind people. The preparation for this Congress started 2 years ago when Oman won the hosting rights in Taipei, Taiwan. Many experts contributed from all over the world to the development of the scientific content of the Congress. I would like to thank Professor Umar Rawas, Chairman of the Scientific Committee, and each one of its members for work well done. The organizing committee worked very hard to make sure the Congress was well planned and all the logistics are in place. I would like to thank all the members and especially thank the professional conference organizer who has worked with us, MCI Middle East. The steering committee that oversaw the work of both the scientific and the organizing committees of the Congress was chaired by His Excellency Dr. Al-Hinai, the Under-Secretary of Planning for the Ministry of Health. The steering committee had members from various stakeholders of Oman's health sector. I would like to thank and congratulate His Excellency Dr. Al-Hinai and all the members of the steering committee for this successful Congress. Since Muscat was awarded the hosting of the 43rd World Hospital Congress, the Secretariat of the IHF worked closely with us. I would like to thank Dr. Eric, the CEO of the IHF, and Ms. Patricia, and all of the IHF Secretariat for their support and guidance. And of course, I would like to thank Dr. Solutions for all his solutions. It's time for the World Hospital Congress journey to move on, and we are happy to pass the honor of hosting the World Hospital Congress to Barcelona, the next host city. Oman is a country that is anchored in glorious history that embraces the future with an open mind and heart. Barcelona has a similar glorious history and indeed has its mind and focus set on improving the healthcare systems and hospitals of the future. Muscat is delighted to give to Barcelona the national symbol of Oman, the khanjar, symbolizing our best wishes and a promise of a continual collaboration. Thank you all and see you in Barcelona.
Thank you very much for this symbolic handover. And may I call Dr. John Duran from the Governing Council from Catalan Hospital Association, who is going to give us a brief overview of what's waiting for us in Barcelona.
Thank you very much, Eric. Salam alaikum. Good afternoon. The Minister of Health of Oman, different representatives, ladies and gentlemen, we are very proud and delighted to host the 2020 in Barcelona, Catalonia, the 44th World Hospitals Congress. Catalonia is a country with 7.5 million people, with its own language and culture, bathed by Mediterranean. It is a welcoming, prosperous, and hard-working country. Catalonia is a country where diversity and integration go hand in hand, which actively embraces innovation and that has clear commitment to social progress. a peaceful place where to live in peace and freedom. This has been true from its beginnings, and nowadays it's stronger than ever, with advanced healthcare and social care models in the wider European context of concern for public welfare. Our country builds bridges and brings together influences from across the globe, with projects that look out of the wall and to the nature in the spirit of the Catalan modernism. Antonio Gaudí, its greatest exponent, believed that imitating nature was the most rational and efficient approach to construction. Today, we believe that social equality is the best way to make our society just and sustainable. Barcelona is the place where this is possible. You will be able to enjoy the culture, the architecture, the Mediterranean lifestyle, as well as share and learn about diverse approaches and initiatives worldwide for sustainability and social progress. The same Barcelona that stepped into modernity with the 1992 Olympic Games and into the spotlight of the world arena, the city with core values of respect and solidarity is the city that awaits you in 2020. So, welcome to Barcelona.
After the remarks and the video, you are not convinced? I don't know, I'm desperate. I'm sure that you already, please take out your phones and everything, 3 to 5th of November, it's blocked. So 2nd you travel, and 6, 7, 8, 9, 10, you can stay in Barcelona because there's so much to see there. So, and as I said, we have the call for paper. It's open. You can take a picture. That's where you can go directly on the website and put in your summary. That's for the call for paper. So now it comes to the end, and with closing remarks. And for that, I would like to call on the stage Dr. Francisco Balestrin, who is our past president, who is going to say a few words for the closing. And just after him, I have a few housekeeping announcements, and that will be the end of our closing ceremony. Dr. Balestrin.
Salam alaikum. In fact, what I'm going to do is to make a final remarks on behalf of our president, Mr. Risto Mitunin, that has to come away. Your Excellence, dear delegates, colleagues, and friends, it has been my greatest pleasure to be here with you at the 43rd World Hospital Congress in this beautiful country of Oman. I want to express my sincerest thanks to our hosts, the Ministry of Oman, and the Eastern Mediterranean Regional Organization of WHO, with their warm hospitality and welcoming in the region. We have really enjoyed the time here with all of our hearts, and we will never forget this experience. I thank especially all participants for the events in the 3-day Congress. Without you, we would not have reached the common feeling and mindset we share right now, and we start returning to our home countries. We have had a lively, intensive, focused, and future-looking gathering around the core topics that will guide us many ways in our journey. When we get together again, we are stronger in aiming for a better world. My special thanks go to our IHF team, without whom this event would not have been possible at all. You have done a wonderful job, and I'm sure that we all can agree. I would like to suggest a big hand to the organizing team, please. Let us reconvene in Barcelona next year I wish to see you, many of you, join us at the 44th World Hospital Congress there, sharing knowledge, networking with peers internationally, and fulfilling our vision under the umbrella of IHF. I'll be there. Once again, my sincere thanks to our hosts and all of you here from the bottom of my heart, and see you in Barcelona. Bye-bye. Thank you.
Thank you very much. And as this is our 19th anniversary, just as a last image before we break for the lunch, we'll show you a little short video on IHF so that you can take this with you home also.
As a healthcare organization, your mission is to deliver the best quality services to your patients. At IHF, we share this goal, and we believe that greater health benefits can only be achieved through efficient management, governance, and leadership. That's why for 90 years now, we at the International Hospital Federation, IHF, have been providing worldwide healthcare organizations with the ground to learn and exchange. Our mission is threefold. We work towards excellence in healthcare by improving professional know-how in order to deliver better services to the populations. We are therefore spreading knowledge through events, publications, communities of interest, social media, and web presence. We act through physical meetings and digital platforms as a network coordinator at 2 levels. Regarding organizations, we support health providers as well as national and regional associations, allowing them to share expertise. We also promote peer-to-peer solutions through a community of leaders, directors, managers, etc. As an ambassador of the global healthcare community, we cooperate with a large array of international organizations. From our headquarters in Geneva, we diffuse recommendations, good practices, and provide relevant training internationally. For years to come, IHF will be dedicated to maintain and further extend its role as coordinator of the global health service community. We will be even more committed to catalyzing management innovation and efficiency to help you provide safe and quality health services. Willing to say your word and exchange with peers? Discover how on our website or contact us at the address below.
Thank you so much. Enjoy the lunch, enjoy the networking, and it was really a great pleasure to be with all of you. Thank you.